Hi, Dr. Travis Reyes. Thank you again for letting me send this in through the video. I appreciate that a lot. So the topic I chose was the benefits of medical marijuana. I know there's a big debate right now in the medical field whether it's positive or negative, and I think the biggest factor on why I decided to do this was because my mother was diagnosed with stage 4 breast cancer when I was in high school, and doing research now and understanding everything, I realized that this medical marijuana could have helped her a lot in many ways, like through her chemo and the pain she went through. So to start my academic concepts, the objective of this is to understand the reasons for, benefits, and ways to use medical marijuana, as well as be able to define the types of medical marijuana. My academic concepts. The first one, students should be able to define the different types of medical marijuana, including marijuana, cannabis, and cannabinoids. I want to connect my first concept to the classroom, so I'm connecting this to Professor Bayonne. She, in her classes, she talked a lot about sociology and just to think critically. So for this concept, I use her classroom and kind of combine it to think critically and to think more outside the box on this medical marijuana and how it can help. My concept 2, students will be able to state the types of medical and mental illnesses in which medical marijuana is useful in treating. For this, I'd like to use Rodney Hume Dawson's class. He talks about the 4 principles he has of liberal studies, and the first one is curiosity and questions. So, well, like I said, students will be able to state the types of medical and mental illnesses in which medical marijuana is useful in treating. And like I said, the first one is curiosity and questions. When you ask questions and you're curious about things, like I was, you find how important this medical marijuana can be. And lastly, concept 3, students will be able to elaborate on the effect of medical marijuana and how that it has on the body, and what occurs at the cellular level when it is ingested. For that, I'd like to use his 4th principle for Rodney Hume Dawson, which is fighting and standing for justice. Like I said, there's such a negative connotation behind this medical marijuana, but now doing a bunch of research and realizing what it could have done for my mother, I'd like to fight and stand for this because I know that there are a lot more positives than negatives. So to start, for the background, the controversial topic of medical use of marijuana has been largely debated since recently become legal throughout the United States. There's a stigma surrounding its use, both recreationally and medically. The first state to legalize it was California, and now there are currently 28 states for both recreational and medical use. So the definition of these 3 types, which is marijuana, cannabis, and cannabinoids. To start, marijuana refers only to the part of the cannabis sativa plant or derivative products that contain substantial levels of THC, the chemical compound that is responsible for the plant's intoxicative qualities. Cannabis is a broad term that can be used to describe organic products such as cannabinoids, marijuana, and hemp derived from the cannabis sativa plant. Lastly, cannabinoids is a group of active chemical compounds found in cannabis. Among more than 100 different types of cannabinoids are THC and cannabinoidal. Moving forward, medical marijuana and forms of administration. There are currently 2 FDA-approved isolated cannabinoids, which is dronabinol and nabilone. Smoking the leaves and buds of the marijuana plant is a common way of ingesting it. Marijuana also can be ingested by consuming edibles in various forms, such as baked goods, candies, teas, and etc. Dabbing is also a method used to consume concentrates of THC oil and is typically used in vape pens. Transdermal patches are also available for mild dosages. And lastly, can also be ingested through pills and sublingual sprays. So how does it work? The effects of marijuana can be felt immediately, passing rapidly from the lungs to the bloodstream to numerous body organs. Cannabinoid receptors are present mainly in the central nervous system and to a lesser extent in the peripheral tissue. The effects of CB, or cannabinoid, are neuromodulatory in nature. Activation of these receptors leads to immunosuppressive, anti-inflammatory, and antioceptive effects. The activation of cannabinoid receptors triggers myriad of therapeutic and psychoactive effects in the body. So, to start with the benefits, I'd also actually like to bring up the fact that my cousin is constantly having seizures, and he was actually prescribed medical marijuana, and through that he was actually cut his seizures down to more than half of what they were. He has them 4 to 5 times a day, randomly throughout the day, and after he was prescribed this medical marijuana, it had gone down to once or twice in a week. So, okay, here are the benefits. The FDA-approved indicators for medical marijuana include nausea and vomiting associated with chemotherapy and appetite stimulation in AIDS. It's useful in the treatment of conditions such as Alzheimer's disease, ALS, cachexia, wasting syndrome, cancer, Crohn's disease, epilepsy, seizures, glaucoma, hepatitis C virus, HIV/AIDS, and multiple sclerosis, which is muscle spasticity. Highly effective treatment of the chronic pain, COLI. More benefits. Although not FDA approved, medical marijuana has been used to help treat neurological disorders and mental illnesses, including anxiety, depression, PTSD, schizophrenia. In a study published by the Psychiatric Times, the use of CBD to help treat schizophrenia resulted in improvement of acute psychotic symptoms. In a study conducted on the use of medical marijuana for epilepsy, like I had stated before, with my cousin, as an adjunctive therapy, results showed significant improvement, with one patient experiencing a decrease in seizures from 50 per day to 2 to 3 nocturnal seizures per month, with sustained symptom relief for 20 months. So like I said, this is also another example of these seizures happening, and through the use of this medical marijuana, it had helped a great amount. And like I said, my cousin could barely do things. He wasn't really able to drive much due to the seizures. He could barely hold his own kid, just because he would never know. And through this, it had helped him a lot. So could medical marijuana be the solution to the opioid crisis? So opioids are pretty much painkillers that are, given out to different patients that need these painkillers, and it is one of the top killers when it comes to overdosing on pills. They're highly addictive. So marijuana is significantly less addictive than the opioids. One study showed that states with cannabis access have seen a significant drop in opioid abuse. Medical marijuana may be the secret weapon in battling this opioid epidemic. Medical marijuana is highly effective in treating pain and has less harmful effects on the body in comparison to opioids. And that is it for my presentation. I just want to thank you again, Dr. Chavez-Reyes, for letting me do this. I appreciate it very much. I know I had a really busy schedule, and it was kind of hectic and everything. And with graduation last night, it was crazy. But yeah, thank you again very much, and I appreciate all your help. Thanks.